Numbers are staggering. Every 15 minutes, a baby is born with neonatal abstinence syndrome, or NAS. It's a withdrawal syndrome that can occur in newborns exposed to certain substances like opioids during pregnancy.
Well, now, thanks to a new nonprofit in Phoenix, new moms struggling with substance use are finding refuge. Team 12's Trisha Hendricks is live at Hush Baby Nursery in Phoenix with more on how they're helping create new beginnings. Good morning, Trisha.
Good morning, guys. This place is absolutely incredible. When you walk through the door, it is so inviting and calm. You'd never know there's a couple babies actually sleeping in another area of the building, and they have room to definitely house and temporarily 12 babies and their families as well. So joining us live this morning here at Hush By is Executive Director Tara Sundum. Thanks so much for having us.
Thank you. Thank you.
So as a mom, knowing how many struggles, challenges comes with motherhood just to begin with, and then when you add some substance abuse, whether it's alcohol, drugs, I mean, that definitely adds a whole nother list of struggles, and you're here to help. Why did you create this place?
Because people need help. These families are really, really struggling, and they want to be good parents. And helping the babies withdraw a little bit easier takes away a little bit of the guilt and the shame that these families already feel. And then really helping them get well so that eventually they can stay together, be unified, and raise their families the way that we want to. Being a new mom's so hard, but being a new mom and struggling with substance use is so darn difficult.
Talk about over the past year. You just had your cake smash. It was the first year anniversary. Congrats on that. Such a big accomplishment. And you have backing by so many donors. So talk about what people get when they come here and then how that funding is continued through ongoing donation.
Absolutely. So when we first meet a mom and dad that find themselves pregnant and struggling with opiates, some are healthy, some are well, but still are being prescribed methadone or Suboxone, their babies are still going to withdraw. They're considered substance exposed. And so we meet these families where they're at. If they just need food, housing, and transportation, they're not ready for treatment, we're still going to be there. We're going to make sure that they have an OB to make sure that they're getting prenatal care, help them get transportation to be there. And then they deliver at the hospital. After they deliver at the hospital, the families ask to come to Hush By. We collaborate very closely with the hospitals, helping them feel comfortable with making that transfer. And then their baby comes to Hush By with them. They can stay 24/7. We're meeting them still where they're at. We have one-to-one caregivers to make sure that the babies are safe. So if their families are struggling, we would have to make sure that safety is number one. By taking them into their own private rooms, quiet, dark environment, which you're going to see, very much home-like. We've been able to decrease the national average length of stay for babies born with neonatal abstinence syndrome, which means babies that are withdrawing, is about 21, 22 days. We are 6.5 days here at Hush By. I am shocked, surprised, being a neonatal nurse practitioner, that our environment and our trauma-informed care has made such a difference. For the families that have come to us struggling, not receiving any treatment at all, we're about 50% in getting those families into treatment.
Tara, thank you so much. You can see the photos behind us, all the babies that they've been able to help find that successful outcome. Coming up in the 5 o'clock hour, we're going to hear from a mom that actually stayed here with her baby girl for a week. And compared to what Tara was saying, that 21-day stay in the hospital, just 1 week, and she's been discharged. It's absolutely incredible. Back to you in the studio.